Thank you very much. Lovely. So what we thought we might start doing is talking a little bit about what we've done so far in the meetings so far. So this is our 6th meeting, I think, 7th if you count that we were doing 2 in parallel. So we've been going for just over a year now. So it's a really good time for us to review what we're doing and seeing if we're kind of meeting the needs of the community that we're planning to do. And I think one of the other things we want to do is build a community so that we're seeing a lot of the people at the same meeting, so you get to know each other a little bit more and you can kind of support each other, because the idea is that you're all people trying to achieve the same things in different environments, and any help to save people reinventing the wheel I think is really good. So I'm just going to share screen now and go through a little bit about what we've done before for those of you perhaps that haven't been at all of the meetings. Okay, does that look like I might be showing the right screen? Yep, great. So this is our community of practice, which is part of the International Alliance of Academies of Childhood Disabilities, and it's one of the initiatives of the Global Professional Education Committee. So the idea is that this practice is, community practice is a space created for people to share their experiences about the implementation and the development of services for children with developmental disabilities. So a kind of mutual learning and mutual self-help group with the perspective of clinicians that have been doing this for a while and have already managed to set up services in their countries, and then others who perhaps are thinking about doing it, and those that would have challenges that they'd like help with, and those that have experiences to share. So these are our objectives: to be able to collaboratively develop, collect and share information and strategies for the implementation and management of services for children with developmental disabilities, to be able to share and adopt evidence-based practice on what can be done in resource-limited settings where early intervention services perhaps are not available, capture and learn from the experiences of modifications done in low resource settings to access services, so sharing those things with each other, and explore and share best practice related to creating meaningful learning opportunities and effective support for professionals in childhood disability. To be able to explore services related to advocacy for children and families, and for the population of children with developmental impairments and their families at a community, regional and national level. And then collaboratively develop and share resources and ideas about how to change the language and concepts of disability to being more about development and more about strengths of children, and that kind of more forward-looking way of thinking. So we've had 5 sessions. Our first session was sort of 2 sessions that were the same. We originally tried to do sessions in different time zones, but actually that just became a little bit too complicated. So we've gone on to 1 session. So that first one gave a bit of an introduction about why Iaacd were launching these COP, community of practice sessions. So I'm just letting people in as people are dropping out. We found that there wasn't a community practice that were fulfilling this role, and there were a lot of lone pioneers that we were talking to that were trying to establish services in their local community, and that they needed some help and support in doing that. So we had that understanding of what community of practice is. So Sananda kindly presented to us around community of practices and what that sort of involved, and then we collected the feedback from the audience about what they would kind of like from our community of practice sessions. So that session was repeated twice in 2 different time zones. And then in September, we invited Gulan Kandekar, who many of you will be very familiar with, and he talked very much about the importance of teamwork and the importance of things like registers within their different communities, and he's done a lot of work around that. And then our 3rd session at the beginning of this year was around gaining political support for driving change and the importance of that. Nana Tatishvili from Georgia was able to come and help and talk about what she's done and the amazing achievements that they've had in Georgia. And then our 4th session was looking at disability in low resource settings. And Sela Manesh, who's part of the group, was talking very much about her lessons from Ethiopia and what she's managed to achieve there and what the challenges are. And then our fifth session, slightly different, about implementing services for children with disabilities during a crisis, Dr. Consuela Ibarra. And that's been really interesting and has now led on to a different piece of work around putting in place some formats and guidelines or ideas for how to put those things in place that we can then share with others, and perhaps people then that are in that situation don't have to reinvent the wheel each time. So some ideas and what they found successful. So that's a piece of work that's ongoing from there with Dr. Ibarra's support. So what we thought would be really helpful to do today is talk a little bit about what we've done so far, which we've done, and then perhaps go into some breakout rooms and look at what it is that you would really like us to do to take this forward, and what things you particularly would like from the group. So what you've found useful for those that you've been before, and what you would like us to do going forwards. So then we'll take that discussion and finish off with everybody sharing those points from their groups, and then take some action points forward about what we would like to do. So I'm going to stop sharing there. Is there anything else anyone from the group would like to add to what I've said? Okay, great. So let me just close bits of my screen. Right, so what I might do now then is pop us perhaps into 3 groups. And so in that group, perhaps identify yourselves as spokesman to feedback, and think about feeding back on what's been useful so far and what you would like this group to do to take forward. What would be useful activities for the group to be doing? Okay, does that sound relatively okay and clear? Great. Okay, I'm just going to do spontaneous groups because that's the easiest. Okay, I'm going to send you all to breakout groups, and we'll have 20 minutes discussion and then come back. Great. Thank you, everybody. Bye-bye. Yeah, probably have to accept your groups, I think. Right. Juliana, are you there? Okay, you have to click that you accept the group. Mather, are you there? Hi, Edivan. Hi, Edivan. Can you hear me? Edivan?
See?
Hi, we've just gone in to do some group work, looking about what we want from the from this group. So I'm just going to pop you into group 3. Is that okay?
Okay.
I think you have to accept the group when it comes.
Progress.
I know some of you are having a challenge with the internet connection, but if you can, it would be great to be able to see each other. Those without cameras on, are you able to put them on?
Gayatri is still driving, so she may not be.
Okay. Oh, I thought she was in the back before.
No, she's somewhere else.
Oh, yeah, great.
Reached home.
That's great. Yes, really helpful if we can see everyone. If you can put your cameras on, that'd be really helpful. Right. We'll perhaps start getting some feedback then. Do we want to start with group 1, going numerical order? Who was your spokesperson?
I think we
Anna.
were group 1.
No, I'm
Shaban.
waving
Right,
to
sure.
somebody else. I'm not volunteering.
Oh, a small
The
one.
lemonish baby's there.
Oh,
She's gonna be part of GPEC always.
she has grown
Oh.
already, such a lot.
Yeah.
Oh, great.
Go on. Don't look at the baby.
I think I'm the
Who's-
spokesperson for the group 1.
Okay, that sounds good.
Okay, so I gave a brief summary of what we were doing because it's Rainer's first time there. So, but the main idea was about the advertising, what we have been talking about. We have to make a better work to reach more people, because even within the AACD, many people doesn't know what we are doing. So what Arnav proposed, that I think it's a great idea, is that 1 week before, we should send to all the committees within the IACD and start from there, so we can spread it out to our peers and our academies. So I think that's the main idea, right?
So the idea, Jenny, was if we can have a designated person who just is in charge of making sure that we are sending out to all our committee members, including governing council and the executive committee and all our committees. And then also, doing the usual tweets and Instagram and emails, asking the academies to circulate. So that was one idea. Another from Rainer was that maybe in 2025, there's going to be 2 24-hour round-the-clock
Listening sessions.
Listening sessions, or not listening sessions. It's actually the meeting's going to be round the clock all over the world, kind of remote sessions. So there is an opportunity for our community of practice to be, participating in some way, maybe putting together some webinars and raising awareness and bringing people together. And I think Rainer is open to all ideas, he said. So that would be fantastic if we could.
That would be great. Yeah, thank you, Rainer. That would be fantastic, I think. Be really good. Really good.
I think it's very important.
and sorry, go on, Rainer.
It's very, very important, actually, not only to focus on the very exciting lectures we have from very intelligent people, but also to know where are the needs of everybody and where could we just join and help each other, learn from each other, hear from each other. So I think this kind of networking, actually, that this is the basis of our motto of the Congress, developing networks for development, because I think it's not only a matter of listening to good lectures, but also it's just a matter of implementation and to look how the work in everyday life is taking profit of that, and how it could be just implemented, what you have learned or what you have seen.
Yeah, no, I think that's really good. Yeah, and good point as well about getting the information out there earlier. And I think that is part of the plan of the group, to get out there to get more people at the meetings.
Yeah, and Gayatri mentioned initiative, particularly with the real difficult times that Sri Lanka has recently been through, that people were finding it difficult to come from remote places. So they have undertaken some initiatives to take, the services out to the remote areas and to the villages, and that may, they would be willing to share some of those experiences. I know there are a number of people here who have experience of community-based rehab. That sounded like a good topic where we could bring in some of these experiences and share them across.
No, that would be great. Yeah, and that's one things we're definitely looking for is, what things should we be doing for next year's session? So that sounds ideal. Brilliant. And something perhaps, Gayatri, you'd be willing to be involved in.
Yeah, Sri Lankan government, we have this action called Family Health Bureau, which Saraji also knows much about, and Saraji is also directly involved. So through that, we are planning to, we are making a structure that should incorporate all the at-risk kids in the country through we have actually one of the best, community practice infrastructures in terms of maternal and child care. So we are making plans to incorporate that early childhood care also into that. It's at the discussion level at the moment. We are trying to identify apex hospitals where people who can look after the child development, and cluster the same areas through to the apex hospitals from the periphery. Maybe Saraji also can add. It's still a developing structure.
Yeah, Saraji's had to leave, so
sorry, I didn't.
No, great.
Yeah. So that's still.
Saraji was in our group, so I can convey what she had to say.
Yeah.
Great. Thank you.
Yeah.
Okay,
we're
lovely.
Still developing it, but it sounds very good, because in that way we will have a system to catch most of the at-risk kids, where we can start from the beginning and implement the practices of early intervention very early. But the existing ones, we are talking of having a community team attached to the same infrastructure that I have been mentioning about the child care and maternal care network, which already have. That is called, the whole of Sri Lanka is divided into medical officer of health areas, MOH areas. Every eligible couple is covered by that structure, actually. So, but at the moment, child development is not certain basic things, the weights, immunization. That is how we cover a great percentage of our immunization cover comes from that program. So we are looking at implementing the same system and giving a little bit more support, like a community nurse, a community team, to detect, identify the at-risk kids early and divert them through the system, that where we can look after them in the community, help them with the trained team through community nurse, physio, OT, the minimum resources, involving minimum resources,
Thank
and
you.
bring, that's the kind
Yeah.
of idea. Yeah.
That sounds great. That sounds great. I might have to pass this on now to group 2. Anna, did you want to say something before?
No, I was just going to tell Jayatri that it would be very interesting to hear it in more detail in one of our COP sessions. So maybe
Yeah, definitely.
the next few
Definitely.
ones.
That would be really good. We'll be in touch, I think. Who is representing group 2?
I'm.
Sunanda, thank you.
So our group had Saraji and Roshni, and then Martina, myself, and I hope I have not missed out anyone else. Now, when we discussed, in fact, because many of them hadn't attended most of the sessions, I think Saraji attended 3 and Roshni was attending for the first time. So I had to really explain some of the highlights of the past sessions. And then I told what I related to most when we came to the discussion about crisis management. I mentioned that it's not just in crisis. In fact, there are pockets in every country which are going through a continued crisis. And so maybe we need to work out where resources are very poor along almost the same lines, but we could brainstorm over that. It's just that in crisis situation, it becomes a short-term work, whereas sometimes you have to plan for a long-term situation. That was essentially the difference. And then everybody discussed what was happening in their places. I think teletherapy was one way they really connected also during the COVID, talking about crisis. And then I think Dr. Gulam Kandekar's lessons on building the infrastructure in the community, I shared that also with them. At that point, I think Martina felt that there wasn't enough support for the kind of services from their governments, but ultimately it turned out that essentially we can't just depend on the government, and everybody faces almost similar situations, except that people linked to academic institutions perhaps have an advantage in creating community outreach, but then ultimately I think we all face the same things. And what turned out was that most of us are short of human resources, trained human resources for establishing disability services. Even later, even to implement and manage that, I think we need resources. Then I think Saraji also mentioned the same thing. When I said that I had to explain the way we work, focused on the early child development of children with disabilities, which is actually an extension of the early intervention, but looking at health, nutrition, and all that. They said that Sri Lanka also has started working towards it, but again, the financial downturn and all those are affecting those. So ultimately, there were a lot of things in common. We did not discuss much about future directions, but I think what we realized was developing trained human resources is a very important aspect. And if one can build these evidence-based practices, through research on what is happening currently, that was, I think, somewhere we all agreed upon. And most important is that each of us, when we are working on these areas, we should understand the needs of the local people and contextualize, even if we are trying to, work out an algorithm or something. That was one thing, I think. So I think Roshni mentioned mostly in institutional settings, how they are just trying to set up a developmental clinic for therapy within a hospital setup. So this, I think, covers basically all that were discussed, and home-based care was coming as important for all.
Lovely. Yeah, thank you. I think that's a really important point. And Salmanesh is leaving us. Thank you, Salmanesh. And Isabel, I think, is going to present for team 3.
Exactly. We were 4. Thank you. We were 4 in our group, and mainly there's 2 lines that we were talking about. The first is to gather all kinds of professionals that have expertise in community-based rehab, to gather those people and teach other professionals, health professionals within the community, And in another way, those people being the leaders of teaching these practices, going farther for parents and the community people, not health professionals. So they can actually go farther with communities that are not in the center or not in the basic areas. So they can go even further. So that's one of the lines, teaching the best practices. And the other line was to implement a new program based on observation for early intervention, early detection, early intervention, and to watch over the lifespan from 2 years to 17 years old in schools. So they don't have the professionals that can watch over these kids, watch the normal or developmental growth that we were expecting. And some kids can go to clinic or the hospitals that were can be taken care of, but some schools can have their own implemented programs. So basically the main interest is to teach, to have or to gather these expertise people, these experts, so they can do this program. One for the community and in the schools. They don't have, there's a lot of children that they were talking about, children going to school, disability or non-disability, and no one's really watching over the developmental, that everything goes accordingly. So that's the main interested point that we were talking about. Further the community of practice, we can really gather these expertise based on community-based rehab experts. That's the main point.
And that seems to kind of be a bit of a thread going through of having perhaps community workers that are trained by health, so we can get much more onto the ground. And yeah, each kind of country seems to do things in slightly different ways, and I'm sure there's things we can learn from different countries that have got programs. Sri Lanka sounds like it's working towards that already, and we can then share across. Arnab?
What strikes me is that apart from the networks which are there in individual countries and which we can share experience, there are also packages of information, like Isabel was saying, that people need to be trained up. They need to understand different conditions, but also a lot of our understanding is generic, things around feeding, things around safety. So there is all kinds of generic things, and there are already some existent fantastic packages and things, and maybe that is something for us, like we did with the CP for GPs or healthcare professionals, producing something more generic and sharing across our networks here, but also sharing across the wider IACD may be quite helpful. And going back, in fact, we were hearing from group 2, what Sunanda was saying was around that, having the ability to share that information across. And I think the GPEC is in quite a good position to be able to actually capitalize on those community-based rehab information. And we could in these meetings, maybe if we add some of these information onto our website, bring in and share that, okay, this month we've put these other different interesting information on our site, with the links or whatever. It's just an idea.
I think it is.
And Shebnam saying as well, they've got a package of training community health workers linked to a toolkit. So again, rather than us all reinvent, it'd be great to share those resources and see if we can put links to them on the Knowledge Hub, and all kind of work together. I think that would be really quite powerful. And Sunanda's just mentioning the UNICEF World Health Organization packages is a good place to start. Mm-hmm. Great, thank you very much. I'm very aware we're running out of time. Always there's more discussion needed than we have time to fill, but I think this is really helpful. It'll be really helpful for the group to kind of look at where we're going forward now for the next year, and hopefully we'll see many of you at future meetings. So these meetings are bi-monthly, and they're at the same time on a Tuesday to try and make it a regular slot. So if you can put them into your diary ahead of time, whatever time it is now in your country, we're due to start an hour before this. So that would be really great to get people regularly on board and build. And then you, as people know what we've done in one meeting, we can kind of add to it and build to it. And you've given us lots of ideas for the next year ahead. So thank you very much, everybody. And yeah, thank you so much for your time and coming and for sharing ideas. Great.
Thank you.
Thanks, everybody.
Thank you.
Have a good day.
Thanks, everybody. Thank
Cheers.
you.
Thank
Yeah.
you. Thanks, everyone.
Thank
Bye.
you.
Bye bye.
Thank you. Have a good day.
Bye-bye.
Bye.
Bye.